Man.
Hi, my name is Jennifer Martinez. I'm going to be your student nurse today. I'm going to be performing a head-to-toe assessment on you. It's going to take about 5 to 15 minutes, okay? So can I go ahead and have your name and date of birth?
Kimberly Rodriguez, 11/22/94.
Okay, so can you tell me where you're at?
Incarnate Ward Hospital.
And can you tell me what day of the week it is?
Friday.
Okay, so I note that my patient is supine in bed. She's able to move without any assistance, so no assistant ambulatory devices noted. So I'm going to go ahead and ask, how are you feeling today?
Good.
Okay, so my patient is in a good mood. Her facial expression shows that. It also shows no signs of ptosis or facial droop. Can I have you swallow for me, please? So my patient is able to swallow, which is good. Now I'm going to go ahead and ask you a couple of questions. Have you felt anxious lately?
No.
Have you had a history of depression?
No.
Have you had any thoughts of hurting yourself or others?
No.
Okay, so my patient is able to hear and keep up with my conversation, which is good. Her speech is clear, articulate, and appropriate. She's alert and oriented ×3. So I note that her nutritional status, she is within normal weight for her height. So I'm going to go ahead and pinch an inch of skin. So there's no skin tenting. That means that you're well hydrated. At this time, I'm going to go ahead and take your survey measures. So it's going to be your pulse, your temperature, your blood pressure, your respirations, your pulse oximetry, and what is your pain level today?
0.
Okay, that's good. So I'm going to go ahead and perform your pupil status. So I'm going to have you stare at my finger as I shine a light in your eye, okay? So your pupil size is about 3 millimeters, and they accommodate bilaterally, okay? So I'm going to go ahead and perform a cardiac and pulmonary assessment at this time. So I note any oxygen devices. I see that you don't have a spirometer, but can I have you take a cough for me, please? Okay, so it's a bit of a weak cough. I note any mucus. So because it's a weak cough, I'm going to go ahead and order a spirometer for you. It's going to help you develop a stronger cough. You're going to take a deep breath in, and you're going to elevate the ball that's in there, okay? So I'll go ahead and order that for you. So I'm going to go ahead and inspect your chest at this time, okay? So I'm going to uncover you. Okay, so have me move your hair, please. I apologize. So I'm going to go ahead and inspect the chest. Note for any cyanosis or anything. So can I have you take a deep breath? Okay, so your chest is symmetrical. You're breathing unlabored, which is good. No use of any accessory muscles, which is great. So now I'm going to go ahead and listen to your breath sounds. So I'm going to be listening in 10 spots, starting above the clavicle. So I'm going to start right here, and then listen for 10 spots. I'm just going to go ahead and listen for that. So I would listen in each section. Okay, now I'm going to have you sit up, and I'm going to have you do the same thing, okay? And remember, each time that I place my stethoscope, I want you to take a deep breath. So, okay, great. So I don't hear any abnormal sounds. It's all clear. So now I'm going to go ahead and check your heart sounds. So I'm going to listen for the aortic, your pulmonic, your Erb's point, your tricuspid, and your mitral valve, which is also your apical pulse. So I'm going to go ahead and listen to that for a full minute. And I note that it's regular. I'm going to go ahead and feel for that, as well as your radial pulse. Okay, so they're equal. So that means no pulse deficit. So at this time, I'm going to go ahead and check your upper muscle strength, okay? So as I push down, I want you to pull up, okay? And as I push up, you pull down. Okay, can I have you do the same thing on this arm? Okay, great. Can I have your hands, please? Do a strong grip. Okay, great. I'm also going to see your fingertips. Okay, capillary refill is about 1 to 2 seconds. I don't see any IV tubings, which is great. So now I'm going to go ahead and do your abdominal assessment. So I'm going to be listening in your right lower quadrant starting. But before that, I'm going to go ahead and inspect your abdomen. So I don't note any lesions, any wounds, any cyanosis. It's no tubings or drainage. which is good. So now I'm going to go ahead and listen to your right lower quadrant and then work my way clockwise. So I'm going to be listening for a full minute in each section. If I don't hear anything, I'm going to go ahead and listen for a full 5 minutes. Okay, so that's good. So I'm going to go ahead and palpate for any tenderness, pain, or any masses. So you let me know if you feel any pain. Are you good?
Yes.
Okay, great. So I'm going to go ahead and cover you back up now. And I'm going to go ahead and ask your voiding and BM habits at this time, okay? So I know that there's no Foley catheter in place, so have you voided any urine today?
Yes.
What was the color and clarity?
A pale yellow and it was clear.
Okay, and what about your BM? Have you had a BM today?
Yes.
Okay, great. How do you like the diet that they ordered here at the hospital?
Good.
Have you been eating all of it?
Yes.
Okay, great. So I'm going to go ahead and work my way down to your feet. So I'm going to go ahead and uncover your feet. Okay, so first thing I'm going to check for is pretibial edema. So I'm going to squeeze for that. And there's no edema, which is great. So now I'm going to go ahead and check for your pulses. So your pedis dorsalis, so that's a 2+, and it's the same bilaterally. And now your posterior tibialis, that's also a 2+, and it's the same bilaterally. So no Dopplers needed. So I'm going to go ahead and have you push down as you're pushing on a pillow. And then toes to nose, please. Okay, great. Now I'm going to go ahead and squeeze your toes and check for capillary refill. And that is 1 to 2, which is the normal range, which is great. So I'm going to go ahead and cover you back up now. Okay, so that's about it. I'm done with my head to toe assessment. I'm going to go ahead and put your call light here, and if you need any assistance, go ahead and ring the call light. I'm going to go ahead and perform hand hygiene and document my findings, okay?